Hi there and welcome back to another video this week. Today's video is going to be a bit different from the usual ones that I put up. In today's video, I sit down with a professional, Dr. Rosanne Dalgado, and I pose some really basic yet interesting questions that I get asked all the time on my YouTube or my Instagram. Dr. Rosanne is a practicing dermatologist, trichologist, and a cosmetologist. She's also a very dear friend and a classmate who has very politely agreed to sit with me and answer all of these questions. And with that, let's get started in today's video. Hey everyone, welcome back to a new series here on my YouTube channel. And I have Dr. Rosanne Dalgado, who is a dermatologist and she practices in Goa, India. Before I get started, I want to tell my community that I will be doing this probably on a weekly basis, and Dr. Rosanne is going to help us talk about skincare. So thank you for taking this time from your busy schedule for this interview. But I remember coming to you when you were based in Dubai, and I love the information you gave me with my skin. That has helped me actually from that time. I've come to understand my skin better. So thank you so much for this. So the reason I wanted to bring you to my channel is that I've got so many questions in these past couple of years that I've been doing my YouTube. It's on skincare, it's sometimes on makeup or even hair care. And I feel like most of these questions that I get are very, very basic. And I thought, what better to get a professional to answer these questions? So this is for my community. And I've got just a few questions since it's just our first interview. I don't want to bombard you with too many questions, but keeping it basic. My first question, I'm just going to pull it up here. My first question is actually a very, very simple question. And this is a question I get asked so many times. And I'm surprised that people don't know what their skin type is. And they don't want to go to a dermatologist to figure this out. Because, of course, a dermatologist can be a little expensive. And it's just a very simple question that they need to know what their skin type is because they're using so many skin products on their face not knowing what their skin type is. So maybe you can help us or guide us and tell us how to figure this out in the comfort of our own home, how to figure out what our skin type is.
Five types of skin that everybody knows of. You have the normal skin type, the oily skin type, the dry skin type. Then you have a combination of these skin types, and you have the delicate or the sensitive skin type. Now, in a dermatologist's office, you'll have these special tools. They are like a small box in which you put your face in, and then there is a scanner that analyzes your skin and tells you everything, right from the skin type to the fine lines and the pores, what can and the pigmentation, what can be done, what should not be done. But a quick way to get analyzed at home is by taking a small tissue paper,
Okay.
and a two-ply tissue paper, and separating it. Just take one side of it and pat it all over your face and hold it up against the light. If there is little or no oil from all parts of your face, that is usually indicates a normal to dry skin type. If there are oily blobs on it, it is more for a sebaceous or oily skin type.
Okay.
And of course, you can touch and examine the skin type that you have. But again, please make sure you wash your hands before touching your face, particularly in today's world with COVID happening.
Yeah.
So an oily skin type would actually feel greasy to touch.
Okay.
A normal skin type feels smooth to touch. A dry skin type may feel rough or when you touch your skin, and a sensitive skin type, usually you have redness and flakiness usually on the cheeks.
Yeah.
Again, with a combination skin type, the patient would feel greasy on the forehead and normal to dry on the face.
Okay.
The other indicators are by looking at your skin. You look at the pore size. A normal skin type would barely have visible pores.
Okay.
An oily skin type tends to have more visible pores, particularly in the cheek area. And a dry skin type again depends on how much the dryness is. You usually see flakiness that is happening. And again, in a sensitive skin type, you might see
I'm sorry that we lost Dr. Rosanne. She will be in just a few minutes. Sorry, you got cut off because of. So you were saying about sensitive skin.
in the sensitive skin type, it's most people who have sensitive skin type would complain that when they wash their face or when they put on products, they feel a burning, tingling sensation. So,
Okay.
and when you look at your skin, there might be a little bit of redness in the cheek area or visible blood vessels in the cheek area. So these are the these are few ways to identify the skin type that you have at home. But ideally, good to go to a dermatologist and get your skin type assessed. But these are the simple ways that you can assess your skin type at home.
Yeah. Thank you so much for that. That's really, really helpful. But could you also give me some problems each of these skin types would face? I know I have dry skin, and like you said very correctly, I do face some flakiness on my skin, and that's my dry skin. But maybe you can give me like oily or combination. Just help us with that.
So in oily skin type, the most common complaint is the greasiness. So most of the people with this type of skin would complain that the face looks very dull and makeup doesn't do good because it makes the skin look even more dull with all the greasiness that is happening. Breakouts are very common. Blackheads and whiteheads are very common in this type of skin. In a dry skin, it's mainly the flakiness and the roughness that one experiences, and products become a little difficult to put because you need to test everything. All products won't suit you, especially thin products like serums and those that contain vitamin C, which is the in thing now, can cause stinging when you apply this product. Even strong smelling products, even your cleansers, can cause stinging. Not much of blemishes on this type of skin, maybe during the menstrual cycle time. That time you may have acne breakouts, but the main concern is the roughness, dryness, and the stinging of the skin when anything is applied onto the skin. Now, coming to the combination skin type, now if it can be a combination with oily and dry, where the T-zone is oily and normal, where the T-zone is oily and the cheeks are normal, or it can even be oily and sensitive. So these are the three combination skin types that you can have. Mostly on the T-zone, there would be acne breakouts, like open and closed comedones. When you do your eyebrows, you tend to break out when you have a combination type of skin. All in all, I have a combination skin type, and it's not a bad skin type too. So basically, these are the little issues that are there with each skin type. But then if things are taken, like you follow a proper routine, most skins are good.
Thanks so much, Dr. Rosanne. And that's such good information. I just wish I had it when I was, trial and erroring with my skin. But this brings me to my next question. I think it's very difficult for us to figure out what, products we need. And I know it's going to take a lot of your time to give us skincare products for each skin type, but maybe you can help us with a very basic skincare routine. And just a very basic skincare routine that I believe most skin types can follow. Maybe you can just help us with that.
To put it very simply, it's you. One needs to cleanse the skin and cleanse it well from makeup. So, although the Koreans have come up with a very elaborate skincare routine, it does make sense. So it involves using, um, getting rid of your makeup in the first step, then getting rid of the products that are used to get rid of the makeup in the second step, and then hydrating your skin, and then applying your products. So the first and foremost thing for anyone to do who has had makeup on their face is to get rid of it with a good cleanser. So if someone has used very heavy makeup, you probably need an oil-based cleanser or a moisturizer to get rid of it. And then you wash off the moisturizer with a cleanser that is made for your skin type. So it may be a cleanser that is made for oily skin type, which usually has a little bit of salicylic acid, or the creamy cleansers, which are made for dry and sensitive skin types, or the normal cleansers for the normal skin type. The toners were used in back in the day. They contained astringents, but this was basically to get rid of all the soap that remains behind when one washes their face with hard water. But now they aren't. They aren't. The water isn't that hard anymore. The face washes we use are very different from the soaps that were used back in the day. So although toners are still called toners, they don't contain the same ingredients as they contained back in the day. So the work of a toner is to further cleanse your skin. So I recommend toners, but they are not as alcohol based as they used to be back in the day. So depending on your skin type, if it's an oily skin type, yes, go in for a toner. If it's a combination skin type, use the toner on your T-zone. And if it's a dry skin type, use a mist instead of a toner. So for a person like you and me, working women who do use a little bit of makeup, it is a good idea to get the makeup off completely before applying products, because then you end up trapping the product, the makeup, the residue of the makeup with the products, and doing more harm than good to your skin. To put it simply, it's cleanser, toner, or mist depending on your skin type. Now there are products called essence, which is like a mist, but basically what an essence does is, imagine your the sponge that you use to clean your dishes. When it is very dry, it is not going to absorb the soap equally and the detergent equally. So the detergent would be clumped at one spot. But when you moisten the sponge and then you put the detergent on it, or the dishwash soap on it, it spreads evenly. So this is what an does. So I would recommend fragrance-free essences. I mean, however much fragrance-free it can be for dry skin, so that the product layering is much more uniform than without one. And serums don't have a vehicle. Like when you use a cream, the ingredient is carried in something, right? But serums are just like water. So serum should apply before you apply any night cream or day cream or sunscreen. So it is cleanse, toner, mist, essence if you have a dry skin, followed by a serum. And then if your night regimen includes an under eye cream, it should follow the serum. And if you want to do a sheet mask, it can be after the serum, because it will help push the serum inside. Then you take off the sheet mask, you can massage the remnants of what remains on your skin, followed by a night cream. So this is the simplified way of layering products. Always serums come before a heavy cream. Night creams tend to be little heavy, sunscreens tend to be heavy, so it has to be serums before night creams. And if you're using makeup, even a little bit of it, please use a toner to cleanse your face completely. Again, if you are a dry skin type or a sensitive skin type, don't use a toner, use a mist. And products get absorbed better if the sponge is a little moist before you put on the.
Yeah, you answered. Actually, my next question was going to be, do they actually make sense? Like, do we actually need to, what's the word, follow a certain pattern with our products? Do we need to layer them correctly? But you've answered that very well by giving us the example of a sponge.
Yes, it is very important to layer your products properly. Serums are efficacious and they are also very expensive. So if you put a cream before you put a serum, you're not getting the benefit of it. So if you are in something for your skin, you might as well, do it the right way.
Mhm. Thank you so much. That was very informative. My next question is something that I get asked all the time, and it's sun care. Now, people genuinely come to me and be like, do we really need sunscreen? I'm a darker person, or is it only for a fairer person? And how much sunscreen should we use? My first question is, do we really need sunscreen? And even if we are indoors, we are working.
Yes, all of us do need sunscreen because it's not just about protection from cancers, but it is also about delaying sun-induced aging, which we call photo aging. Now, there are different skin types, like dermatologically, we have 6 different skin types. So, right from skin type 1, which is a very pale, light skin type, on exposure to sunlight, they only get burnt, they never get tanned, to type 6, which is the dark skin type, which on sun exposure never get burnt, they only get further tanned. So all these skin types, this wide range of skin type from 1 to 6, all of us require sunscreen to keep our skins looking healthy and glowing. Of course, the lighter skin types require them for a different reason. Photo protection from the harmful effects of sunscreen. But starting sunscreen for browner skin types in the 20s helps to keep aging at bay. Not at bay, but it slows down the aging process dramatically.
Do we really need to wear sunscreen if we are indoors? Say for me, I go to work, I work indoors, I do not see the sun. I probably see 20 minutes of the sun when I'm probably going to work, and maybe another 20 minutes when I'm coming back. Otherwise, I'm indoors. Do I really need to wear sunscreen?
Yes, because the light that is filtered in through your window is the UVB is taken out. The glass shields us from UVB, but UVA still comes in, and that is the one that causes melanosis. It triggers pigmentation. It triggers some amount of skin aging. So yes, even if you wear those, uh, I tell my patients a good practice is to keep your sunscreen near your toothbrush. The moment you're brushing your teeth, that's when you apply it. So if the patients who are using other skincares like serums, you can follow the routine of.
We lost Dr. Rosanne once again. So, Dr. Rosanne, before we got cut, you were explaining to us about sunscreen. I have another question. And you mentioned if you're sitting in front of the window. What if I'm not sitting in front of a window? Does that...
The light, it is important to use a sunscreen on a regular basis. Now, the protection factor, the SPF, varies from person to person. Okay. So the lightest types have to use an SPF of 50. The others 100, and there are sunscreens that say it's SPF 100. Those are unnecessarily too thick, and I don't recommend them. Okay. Someone with a very pale skin type, the ones that on sun exposure get burnt, they are the ones who need an SPF of 50. Okay. Skin types that are browner, an SPF of 30 is fine. Slightly darker skin types, an SPF of 15 is fine. So the lower the SPF, the less thick is the sunscreen. So then again, it is important to use a sunscreen, because if you're using all the products to keep your skin looking a certain way, if you're not using a sunscreen, you're undoing the effect of those products. So it is, to put it simply, it's mandatory to use a sunscreen.
Okay. Like you said, we should keep it next to our toothbrush.
Yes.
Now, I know there are two types of sunscreens, but maybe you can elaborate on that a little more and tell us what kind of sunscreen should we be looking for,
Yes.
and what are the difference between these two?
So, dermatologically, there are two types of sunscreens. You have the physical sunscreen, which is your zinc oxide, titanium dioxide, and you have the chemical sunscreens, which are your avobenzone, oxybenzone group of sunscreens. So the difference between these two sunscreens is, a physical sunscreen is called a physical sunscreen because it's a physical barrier. You apply something and the sun reflects or doesn't penetrate your skin. Vis-a-vis a chemical sunscreen is one which gets activated with the heat of your body. So when you apply the sunscreens that contain avobenzone, oxybenzone, which are not seen on your skin, like a physical sunscreen, the best example I can give you is how the cricketers use that white patch. Uh, that is a physical sunscreen. You see it. A chemical sunscreen, you have to apply it at least 20 minutes to half an hour before you step out of your house.
Sunscreen.
Yes.
Okay.
So although it's called a chemical sunscreen, is because it gets all, basically everything is a chemical. So because I'm using the word chemical, I want people watching this to say, okay, I should not be using this. Even water is a chemical.
That is true.
So basically, chemical sunscreens, they are called this because there's a chemical reaction that occurs with the heat of your body to activate the sunscreens. These are the ones that are not seen on your skin. When you apply them, your body temperature activates them to photoprotect, to protect you from sunlight. So important to use your sunscreen 20 to 30 minutes before you step out of the house. So that's why keep it near your toothbrush.
My next question is, if I'm in the office now, I've personally heard that you need to reapply your sunscreen. But what if I'm in the office? Like I suggested earlier, I'm giving an example of myself. Do I really need to reapply the sunscreen, or just applying it once a day would be fine?
See, a person who has a good skin and they're maintaining the goodness of their skin, it's fine if you don't reapply your sunscreen if you are in the office. But a person with skin condition like melasma, which is made worse because of light exposure, or a person who is getting treatments done for any kind of pigmentation, then in their case, it is important to reapply a sunscreen. You need, now it can become cumbersome because you would need to rinse off the makeup and then put the sunscreen on. But probably, there are some companies that make compact powders.
Yes.
The form of sunscreen, those can be used at least in the areas where the concern is. So if you have melasma in this area, probably you can just, do a touch up kind of in that area, if not the whole face. Because the effect of a sunscreen depends again on the SPF. So a higher has a longer time.
Okay.
A small SPF has a shorter time. So if you're using an SPF 15 and you are working outdoors, you have to probably apply it every 60 to 75 minutes.
Yeah.
Higher SPF, it might give you a time of 2.5 to 3 hours.
Okay.
But again, the quantity also matters. If you just apply a peak size of SPF 100, it's not giving you protection of a coin size amount of SPF 15. So the quantity also matters.
So now that you brought up the quantity really matters, How much sunscreen should we be putting on our face?
So ideally, these two lines between your palm.
Yeah.
So this is, so in India, I say size of a 1 rupee coin.
Okay.
In UAE, the size of a 1 dirham coin.
Yeah.
So it these two, it has to be the size of a teaspoon. So
Have you
that,
heard about the two finger method of applying sunscreen?
no, enlighten me.
No, so I follow a lot of Asian bloggers actually, and they have a
Okay.
two finger and a three finger. So the two finger is for the face, and then one more finger for the neck. So I've been
Okay.
using that. So I'm not sure whether that is the right amount, but
It
it's like two lines, and
it is. So this is basically, I think, taken from how, as dermatologists, we prescribe medicated creams for our patients. So
okay,
usually call this a fingertip unit. So it
okay,
is from this line till the tip of your finger.
okay,
This is enough to cover the size of one palm.
okay,
So this much, it's basically a dosage for how to dispense creams. So
okay.
using a steroid cream for, say, psoriasis.
Mm-hmm.
So this is how someone has psoriasis on their full arm. Then they
Uh-huh.
would require about 3 of these. So it's
That's
kind of,
interesting. Probably, yeah, that's where it comes from. Thank you. So, this past year, I've been getting a lot of questions from pregnant ladies. They've been reaching out and saying, I don't know whether I should be chemical exfoliating because I'm so used to it. I've been using sunscreen. I don't know whether I can use sunscreen. I've been using retinol. And they reach out to me asking me whether they can use these products even after getting pregnant. And I always tell them to check with their gynecologist. But maybe you can give us a little bit insight if people are trying to get pregnant or if they just find out that they're pregnant. What products or what ingredients do they avoid before they actually go and see a gynecologist?
every individual is different, so every pregnancy is different. It
That is
is best to check with your treating gynecologist, your obstetrician, before getting into a skincare routine.
mhm,
But just simple, in the first trimester, it is best to avoid all products. It's okay to use a sunscreen, it's okay to use a face wash, but anything that contains retinol, any kind of antibiotics, especially for the acne, like how you have your
retinoid.
clindamycin and
Yeah.
yeah, and then your retinols like your retinaldehyde and tretin and
Yeah.
all those anti-acne creams basically are best avoided. The only anti-acne cream that is safe in pregnancy is benzoyl peroxide. So you get it as Brevoxil or Benzac. So you can apply it directly only on the zit, which is there. First 3 months, best to avoid everything
Mm.
other than sunscreen, face wash, moisturizer. These are okay. Benzoyl peroxide is okay. Post 3 months, it's okay to use vitamin C serums, hyaluronic acid serums. See, although the studies are very limited in pregnancy and usage of these products,
Mhm.
and the absorption from the skin is very, very minimal. But then why again take a chance?
That is true. That is true. What about with sunscreens? Can you use the chemical and the physical sunscreen, or it's much better to use either or?
Um, See, physical sunscreens are not really recommended as much because they look like a mask. You look like a mime artist if you're wearing a physical sunscreen. But most of the sunscreens that are available do have zinc oxide in it. So there is some amount of, because nobody applies their sunscreen 20 minutes before they leave the house. So companies do put a little bit of zinc oxide in it to give you some amount of protection, because uh, you know most of us just slap on the sunscreen before we run out of the house. So the sunscreens that are available in the market are actually a mixture of the two. So sunscreens are not contraindicated in pregnancy. It's fine to use them.
Okay, that's really good information. My last question. Um, we hear all the time we have to eat right for our skin, and we have to drink 2 to 3 liters of water. What is the right food that we need to eat for our skin, and what should we be avoiding? And does drinking a lot of water, really play a factor in our skin?
To put it simply, it is you are your skin. They say you are what you eat, right?
Yeah.
So it's even with respect to your skin is what you eat. So if you are into a lot of if one is into a lot of junk food, there's going to be junk. So you have to have a balanced diet to have a good skin. Simply because what happens is when one eats a lot of processed foods, the salt content in it is very high, which is very dehydrating for the skin. So the plumpiness of skin goes off, and it gives the appearance of a very dull skin, no matter how many treatments one might be doing. So lifestyle is not just diet. Lifestyle is very important when it comes to having a good skin. So food rich in antioxidants, so basically colored fruits and vegetables like your capsicum, beetroots, celery, all these carrots, which are rich in colors, and when they're rich in colors, they're rich in antioxidants, and antioxidants are good for your skin. It delays the damage done by light, by pollution, by the products that you're using. It takes the beating for you rather than letting the skin have the beating. So antioxidants are very important, and they are very easily available in colored fruits and vegetables. And yes, they are very expensively available in little bottles which are labeled antioxidants. So better to choose the former.
Okay.
So yes, drinking water is also of utmost importance. One is the lifestyle that all of us follow is very dehydrating. So when you're sitting in an AC room, imagine a straw sucking out the hydration from your skin. That's what air conditioning does to your skin. So very important to be having 2.5 to 3 liters of water on a daily basis. Uh, Coffees, teas, they're very dehydrating again. So the more tea and coffee you drink, the more water.
Including teas. I'm surprised.
Yes, tannins also are very dehydrating. So it is not, although coffee has been made the poster child for that. It is tea has just been enjoying the
right in the sun, like, oh, I'm here. I'm healthy. Okay, that's new to me because I'm a big tea drinker. So I'm like, and I don't drink coffee. That's dehydrating. I'll drink
no,
healthier
it's
options.
tannins. Tannins may be less, but they are not. Uh, you cannot say that tannins are completely innocent. They're not.
Okay.
So it's the more tea and coffee you have. So roughly for every cup of tea that you have, you need to have 1.5 cup of water just to flush out the system.
Yeah, the tannins.
So yes, exercise is very important for a good skin type. When you sweat, it kind of let's put it as a hydrofacial for your skin. When you sweat it out,
Okay. Yeah.
there's a lot of toxins coming out. There's blood pumping into your dermis, which makes the skin look fresh and bright. So some amount of exercise, a balanced diet rich in antioxidants, and adequate amount of water is very important, even for those having a desk job, because you just most of us are just sitting with at our desks, and there's not much of movement happening. So there's a lot of blood stagnating in the limbs. So that is one thing that with the with this kind of a lifestyle, it is important to have a balanced and a healthy lifestyle for a good skin.
Thank you so much for that, such insightful information. And thank you for your time. I'm going to end this interview with you here. And hopefully we can do another one. I actually enjoyed this. It's good for me. Sorry, you were saying?
I enjoyed this interview, and it was a pleasure talking to you and putting out information right there. Like I told you at the outset, my aim for this is to put out good information out there for people like you and me to who are into skincare, to help out others who don't know much or who are doing wrong things because they've picked up wrong information from wherever.
There is so much of wrong information everywhere. In fact, it's not only them. There's sometimes even I've picked up wrong information from certain places. And I always go back to Google to check. But sometimes you need a specialist telling you the rights and wrong because this, like you said, there's so much of information out there and there's both sides as well. So thank you so much for your time. And hopefully we can do one soon again.
Thank you. Thank you for having me.